How to make medical art. In this article, we're going to talk about how medical artists use anatomical knowledge of the human body and creative techniques to create realistic depictions of what's inside your body. What is medical art? Medical art is a challenging discipline that requires creativity, anatomical knowledge, and skill with a variety of media. A medical artist must be able to combine these three components in such a way as to summarize complex concepts for doctors who may not have time to read lengthy reports. They also need the skills necessary to create detailed drawings and illustrations from scratch, often given limited information or reference material. Medical artists can be found in corporate medical departments and agencies, mostly to do work for pharmaceutical companies and other biomedical concerns. They also work with doctors and surgeons as they seek to diagnose disease or injury. In fact, medical artists are often called upon to demonstrate procedures for surgeons so that the doctor can better picture what is going on during an operation. More rarely, a medical artist can be found working with scientists in research labs, providing anatomical drawings related to their specific project. What do medical artists do? Every person's body is different, as are the diseases or injuries affecting their anatomy. As such, it takes a lot of skill and experience for a medical artist to create an illustration of an individual patient's unique condition. Medical artists need to know the subject of their work intimately. They might need to know which tissues are most affected by a particular disease or injury, or which organs have been removed during surgery. While they would likely be working with a stack of patient files, the medical artists responsible for creating detailed anatomical drawings and illustrations might focus on just one or two patients for an extended time. Artists must also have a good deal of anatomical knowledge in order to create accurate drawings and illustrations. They need to keep up with new developments in that field and learn about all kinds of new treatments and procedures. Medical art students need to learn a lot of different ways to lay out drawings and illustrations, all while learning how to create images that are as lifelike as possible. The artistic side of medical art can take many forms. Artists can create drawings that showcase the human body in action. Or they might focus on a specific disease or anatomy, creating images that show what the disease does to a person's internal organs. They can also create simple sketches or even detailed pencil and ink drawings of cells and organs drawn directly from photographs or cadaver dissections. All of these things require an understanding of the human body, organ structure, and anatomy and how disease affects them. At the same time, artists need a good eye for detail and the ability to create illustrations that are simple and understandable even if they don't have any artistic skill. This is generally considered more of an artistic skill than a medical one, but it's still important in a world where complex medical issues are often boiled down to simple drawings for doctors who may not have time to read lengthy reports. The role of technology in medical art. Medical art is an old discipline, and it used to be that artists were the ones who actually made the drawings at all. Today, this is a job done by computers that essentially program themselves once they have been loaded with a set of proper instructions. While computer-generated imagery, CGI, is not as accurate as medical artists can make it, it has several advantages. It offers a high degree of accuracy and consistency, which means that the same images can be used in all kinds of different products and in locations around the world without any kind of variation in quality. It's also easier to move these images around and rearrange them, turning them into animated sequences for film or interactive presentations on a website. That said, there are still situations where medical artists still create their own illustrations by hand. Some people just like the look and feel of an artist's touch, so they want to see real artistry in their medical illustrations. What does medical illustration of goats look like? The bottom line is that veterinary medicine doesn't have a very good method for rendering the insides of animals and humans accurately when it's time to create an artistic depiction of a live animal for slaughter. The reason is that animals do not lie still on a slab for any amount of time without giving off body heat or changing position or shape in any significant way. So there's no way to take a cadaver and prepare it in such a way that you can easily get the best anatomical view possible of all the organs you want to show. That means that for most species, including humans and other mammals, an artistic depiction of what's inside a body is only done when the animal is dead or dying. This poses an interesting challenge because many people are squeamish about looking at what's inside the bodies of slaughtered animals. For this reason, there are some organizations that are willing to hire medical artists to create depictions of the inner workings of animals before they're killed. For example, one slaughterhouse might pay a medical artist who specializes in viewing cadavers to create a series of clear illustrations showing what's going on inside the animal. This way, people can be sure that it's an accurate picture without seeing something they personally don't want to see.